multiple-choice questions focused on Pseudomonas aeruginosa, including clinical features, risk factors, treatment, and pathophysiology. Each question includes 5 answer choices, the correct answer, and explanations for why the other options are incorrect. Question 1. A 32-year-old man with a history of intravenous drug use presents with fever and a necrotic skin lesion on his thigh. Blood cultures grow a gram-negative, oxidase-positive rod. Which of the following is the most likely diagnosis? A. Cellulitis caused by Streptococcus pyogenes. B. Ecthyma gangrenosum due to Pseudomonas aeruginosa. C. Necrotizing fasciitis by Clostridium perfringens. D. Impetigo caused by Staphylococcus aureus. E. Cutaneous anthrax caused by Bacillus anthracis. Answer B. Ecthyma gangrenosum due to Pseudomonas aeruginosa. Explanation: ecthyma gangrenosum is a necrotic skin lesion associated with P. aeruginosa bacteremia, particularly in immunocompromised patients or those with intravenous drug use. AS pyogenes causes cellulitis, but typically doesn't produce necrotic lesions with bacteremia. C. perfringens causes gas gangrene, characterized by crepitus and rapid progression. D. S. aureus impetigo presents with honey-colored crusts, not necrotic ulcers. E. B. Anthracis causes painless ulcers with a black S scar, but it's rare and associated with specific exposures. Question 2. A 25-year-old contact lens wearer presents with eye pain, redness, and decreased vision. Examination reveals a corneal ulcer. Which organism is most likely responsible? A. Staphylococcus epidermidis. B. Pseudomonas aeruginosa. C. Neisseria gonorrhoeae. D. Herpes simplex virus. E. Candida albicans. Answer B. Pseudomonas aeruginosa. P. aeruginosa is a common cause of corneal ulcers in contact lens wearers due to contamination and its ability to adhere to lenses. A. S. epidermidis is less virulent and rarely causes corneal ulcers. C. N. gonorrhea can cause conjunctivitis but not typically corneal ulcers in this context. D. HSV can cause keratitis but presents with dendritic ulcers. E. C. albicans is a fungal pathogen more common in immunocompromised patients. Question 3. A 60-year-old diabetic patient develops a urinary tract infection. Culture grows a non-lactose fermenting oxidase-positive gram-negative rod. Which of the following is the most appropriate antibiotic therapy? A. Amoxicillin. B. Ceftriaxone. C. Ciprofloxacin. D. Nitrofurantoin. E. Doxycycline. Answer C. Ciprofloxacin. Explanation: P. aeruginosa is a common cause of UTIs in diabetics and is sensitive to ciprofloxacin, a fluoroquinolone with anti-pseudomonal activity. A. Amoxicillin lacks activity against P. aeruginosa. B. Ceftriaxone has limited activity against P. aeruginosa. D. Nitrofurantoin is ineffective against P. aeruginosa. E. Doxycycline is not effective against P. aeruginosa. Question 4. Which of the following virulence factors produced by Pseudomonas aeruginosa inactivates elongation factor 2, EF2, leading to inhibition of protein synthesis? A. Exotoxin. A. B. Piocyanin. C. Elastase. D. Phospholipase C. A. Exotoxin A. Exotoxin A inactivates EF2 via ADP ribosylation, halting protein synthesis and leading to cell death. B. Piocyanin generates reactive oxygen species, causing tissue damage. C. Elastase degrades elastin, contributing to tissue destruction. D. Phospholipase C degrades cell membranes. E. Alginate is involved in biofilm formation, aiding in chronic infection persistence. Question 5. A 45-year-old man with cystic fibrosis presents with increased cough and sputum production. Sputum culture grows mucoid colonies of a gram-negative rod. Which characteristic of the organism contributes to chronic colonization in this patient? A. Capsule formation. B. Spore formation. C. Pili-mediated adhesion. D. Biofilm production. E. Toxin-mediated cytotoxicity. Answer: D. Biofilm production. P. aeruginosa produces biofilms, particularly in cystic fibrosis patients, leading to chronic colonization and resistance to antibiotics. While P. aeruginosa has a capsule, biofilm formation is more critical in chronic colonization. B. P. aeruginosa does not form spores. C. Pili aid in adhesion but are less significant in chronic colonization. E. Toxins contribute to acute infections, not chronic colonization. Question 6. Which of the following antibiotics is least effective as monotherapy for treating Pseudomonas aeruginosa infections due to poor performance in acidic environments? A. Piperacillin tazobactam. B. Ceftazidime. C. Ciprofloxacin. D. Gentamicin. E. Meropenem. Explanation: Aminoglycosides like gentamicin have reduced efficacy in acidic environments and are often used in combination therapy for P. aeruginosa. A. Piperacillin tazobactam is effective against P. aeruginosa. B. Ceftazidime generation cephalosporin with anti-pseudomonal activity. C. Ciprofloxacin is effective against P. aeruginosa. E. Meropenem is a carbapenem effective against P. aeruginosa. These questions cover various